Now, since the outbreak of COVID-19, the health sector has focused almost all efforts to ensuring the pandemic is brought under control. Unfortunately, this has crippled response and attention to other diseases and ailments. One of such a disease requiring constant monitoring is sickle cell anemia. Individuals of any age with blood disorders such as sickle cell disease may be at an increased risk of developing serious COVID-19 symptoms. Joining me via Skype to discuss the management of sickle cell in the midst of the pandemic is the Executive Director, Sickle Cell Advocacy and Management Initiative, Toyin Adeshola. Good morning. Thank you for joining us on TVC Breakfast.
Thank you for having me.
We know that there are so many stressors that trigger serious health consequences for persons living with sickle cell disease. But talk to us about COVID-19, how that also is constituting a major stressor.
Well, yeah, it is actually being a stressor because some of the so-called symptoms of COVID-19, like the chest issue, people with sickle cell have it is called acute chest syndrome. So sometimes when people are admitted or they go to a hospital and the doctor is not very conversant with sickle cell issues, they tend to mistake it for COVID-19 issues. So that can create a lot of challenges. And then also the fact that we as warriors, we are afraid of going anywhere, just anyhow, or to any hospital. So sometimes some of us decide to do self-treatment, which can be detrimental to a lot of the things we do. So it's really challenging, and of course the doctors are focusing more on COVID-19 and already stressed about it, that a lot of times we have to find ways, other ways to manage our health. Yeah.
So what risks, factors rather, does COVID-19 pose for sickle cell disease warriors?
Well, because our immunity most times is low, there's a tendency for us to have COVID-19 virus if we're not careful. We are under the chronic illness category, so with pre-existing conditions, so there's a tendency that things can get challenging. So that is why we always encourage people to boost their immunity as much as possible, take a lot of vitamins, eat a lot of fruits, vegetables, and take other things that can help boost their immunity so that they are not susceptible to virus. And of course, they have to practice putting on a mask, washing on your hands, and all other COVID-19 things that you're supposed to do. But in the meantime, we ourselves as an NGO are just trying to monitor our own people. We call them regularly to check on them. And when we find there's an issue, we try and guide them to a relevant hospital.
Now, we know that one of the safety protocols that was put in place by government and even across the world was social distancing, hand washing, and all of it. How challenging was it, especially knowing that sickle cell warriors need that support?
Very challenging, really challenging. I remember when the actual lockdown happened in March last year. It was very difficult to reach our people. We had to pay special courier services to try and get drugs across to them, get food across to them. And it was really, really a challenge trying to do that. So I can imagine ours was in a small scale, let alone other people or government trying to reach out a lot of people. So it's been really challenging trying to meet up with them. Some of them we've not been able to reach because they are not on phone. They're very, very low income. So it's been challenging, but we've been trying to work our way through it every step of the way. Yeah.
Well, we see that some countries like the US issuing special precautionary advisories directly to persons living with sickle cell disease. And we also see that Ghana signed an MOU with a global medicines company to improve diagnosis and accelerate treatment for people living with the disease as well during the pandemic. What were your expectations of government, or did government should government have done something perhaps different differently for persons living with sickle cell disease?
Yeah, definitely they should have done something. There are a lot of people living with sickle cell in Nigeria, and I think there should be more precautionary measures and more support, considering what we go through. I know there's a bill in the House currently to try and see what they can do. But in the meantime, a lot of us can't wait. I lost a friend who was a warrior to COVID-19. I mean, the irony of it all, they always think that, okay, it's sickle cell that will get you, but this was COVID-19. So I think a lot of times we tend to, I know the government is caught up with a whole lot of things, but I think at the same time, whether it's through private sector, there should be a way that we can help people with sickle cell so that they don't have to face these challenges. They can go on with their life, go to work, because there's a tendency to fear that, okay, if I go out, will I get it? How will I cope and all that? And having the two, COVID-19 and sickle cell, can be really traumatic, and God help you if you survive. Yeah.
Now, there is a talk about vaccines, which the government is looking forward to receiving sometime in the year. And people have been reacting. There's been divergent reactions to the vaccines because of the myths around it, and setting the misinformation as well around the vaccines. And there's been fears about vaccine hesitancy. There's been fears about people's disposition towards taking the vaccines. What level of advocacy has been going on, especially for persons who are warriors in this aspect, talking about sickle cell now?
Yeah, well, I know that for quite a number of us as NGOs have been trying to hold programs to even educate ourselves on the vaccine, because it's one thing giving it to people who don't have sickle cell, let alone people who have sickle cell. So we've been trying to educate ourselves, trying to understand it a bit more. I know in UK there's a lot of efforts in that direction, and I know people with sickle cell have taken the vaccine, but unfortunately the education is just within a little space. I think there should be more education nationwide on the issue. The reality is that even COVID-19, people don't still believe it exists. I know that for a fact. I see it on a regular basis. So trying to educate people generally about the vaccine may be challenging, but we just have to keep repeating it. And people should also, the government should still inform us on the types of vaccines, what is going to be doing, what are the reactions, what are the challenges that might occur. You know, because definitely some people might have allergies to it and all that. So I think there needs to be more education concerning it, so that people are aware in different languages, not just English, because let's face it, a predominant part of the people are living in poverty, they're not educated and all that. Yeah.
And are you looking to take that up as part of your efforts in advocating as well?
Yes, definitely. We are just trying to look at what the government is doing first before we start talking about it, because we need a greater understanding of it ourselves, so that we don't pass on the wrong information at the same time. Yeah.
Now, Nigeria currently has the highest burden of sickle cell disease, 30% in the world, and the estimate of about 91,000 babies are estimated to have been born with sickle cell anemia. That was in 2010, and that's about 11 years now. A lot has been said, and we know that government has made efforts in terms of advocacy, but some persons say there are still gaps that have to be bridged. What are these gaps that you think the government can improve upon, especially at a time like this?
Well, there are a lot of gaps. I remember growing up when I was living, when I was having challenges, a lot of challenges with sickle cell. There wasn't information out there. Everybody is each man to his own self. It's a bit better now. I remember when I was writing my book that it's a challenge living with sickle cell in Nigeria, because the information is not out there. I think there should be more stringent information concerning sickle cell, and broken down into the basic language people can listen to and hear, Because sometimes when we ourselves talk, it's like it's going over their heads because they don't basically understand. And also for support, medical support, HMOs, there's a lot of things about HMOs not taking people with chronic illness, which is not right. There should be some advocacy towards that so that people can afford their medical care whenever they need it. There are a lot of challenges living with sickle cell, and they need that medical care to be able to cope. Yeah.
One other thing that people think that the government should perhaps look into is the aspect of genotype testing, screening, especially when babies are born. I wonder what your reaction is to that.
Yes, I'm all for it. Genotype screening and also newborn screening. Newborn screening when they are born. That's what you're talking about. Newborn screening is very important, and it's not just for people with sickle cell. You can be able to detect different challenges when a baby is born, whether the baby is blind, whether it has other defects and all that. And it's really disheartening that we as a country, as big as we are, we don't have a proper newborn screening. So it's very important. It helps people start treating the child with sickle cell at a very early age so that the mortality of the child is improved. Yeah.
Now, earlier you talked about information in your book, that's access to information about sickle cell. Another thing you try to address in your book is the why me question. And we see that a lot of persons keep asking that question. I want you to, from your experience over the years, perhaps encourage some persons who are watching us this morning, how you have been able to deal with, how you've been able to stand as a warrior and deal with this moving forward.
Yeah. When I wrote the book, Still That Standing, at that point in time, I like every other warrior, was asking the proverbial question, why me? But I've realized that there are certain processes we might have to go through. Sickle cell is not the only challenges in the world, and the people who are going through wars, you'll be surprised. And I always encourage people to find their why, find their purpose, because within that challenge, within that trauma, there's a process that God is taking you, and that is how I was able to overcome mine. When I started the NGO, I realized that because of my challenges, because of my experiences, I was able to impact somebody else. So whether you're living with sickle cell or any other challenge for that those lessons are there to even help another person who doesn't even know much about it. And we should just put our chin up, be positive, trust God, have faith, do what you're supposed to do, and then just how will I call it? Accept the situation. Not that accept in the way that this is my end. And no, accept that this is my reality. Find a way to work around it, because that's what I've always done. When I was told I was going to be on a wheelchair, I went down for a while, but I learned to accept the situation. Sometimes we go through denial, anger, begging, and all that, all the process of grief before we get to acceptance. So the moment we accept the reality of it, what can I do about it? What can I change? What can I manage around the situation? It will make us better, and find a good support system that will help you. I was blessed with a good support system, family, friends, and even doctors, medical doctors. That will help you to be able to strive to be better. There's nothing stopping you. You are limitless living with sickle cell.
Acceptance, you mentioned acceptance, which is one of, it's a huge challenge for a lot of persons, accepting the reality. Perhaps there could be a formula to saying, let me accept this situation. If there is, could you take us through it?
Well, I would say there's a formula, but there's a process of grief. You're allowed to grieve. If it's not only when somebody dies that you grieve, when you face some traumatic challenge, you grieve. And you need to go through that process, but just realize that don't stay stuck in denial. A lot of people are in denial that the issue is there, and that doesn't help you. Accept it. I used to pivot and find a way around issues. Like when I learned I was going to go on wheelchair, I now started saying that, okay, how can I manage my situation? How can I move around? How can I use internet to help me do a lot more stuff than I would have since I cannot move around? So when you are going through that process, start analyzing, okay, this is my reality. what can I do about it? What steps can I do to make it easier? Is it family support? Is it using technology to help me? Is it using my environment to help me? That moment that you decide that you accept and you now process whatever steps you're going to use to be able to make your life better is the moment that you realize that it's not that bad. Yes, it may look bad in the initial state, but once you be able to determine what you're going to do and trust God, have faith, pray about it, the Lord will always take you through that process, regardless of what you're going through, once you trust Him, and everything else will be okay. Yeah.
All right. Thank you so much, Toyin Adeshola, Executive Director, Sickle Cell Advocacy and Management Initiative. Thank you for your time.